have a 10-year-old with severe autism and a 12-year-old with Asperger's.
She is 15 years old now, and she's PDD.
My son's 7 years old. He's considered at the higher end of the spectrum.
My son is 10 years old, and I believe he falls at this present day under very mild, moderate to mild autism.
Well, we've seen that both of them seem to be sleeping better. They sleep the whole night through. They're less anxious, and they seem to have fewer sensory problems.
One of the huge impact that the program has in Samantha, the treatment I mean, is language. Expressive language, that will be always Samantha's biggest challenge. It was like 3 weeks when we started the treatment, then the speech therapist came to us and started, wow, you know what, she's now started using 6 to 8 words per sentence. And it was huge because more than a year we keep pushing the goal, trying to increase Samantha's expressive language. And it was a huge one. And then the other one is social awareness increase. Sometimes when I'm tired, she doesn't really realize that I'm tired, and then we have like 4 weeks on the treatment, and then she saw me and said, "Oh, Mom, you look tired," and then don't worry, I can help you, I can do it. And I was like, wow, for me, you always need to prompt her. Whatever she had to do, we have to do a lot of prompting, but not anymore.
Her drawings, her spatial awareness, and confidence. Her confidence level went up. She used to kind of give up when she wants to explain something to you. Now she doesn't seem to do that as much. Maybe when it's homework and it's hard, but not in conversation, which is good. She's more calm. She actually is more teenagey. She has her own ideas, her own opinions. Either way, she has them. She's a little stubborn, but she's more confident to say, no, I don't like this, or how about this? How about I want that instead. So she's a little more confident when talking. In 3 months, he changed a lot.
He's more responsive to people. I have a daughter at home, and he just didn't have any interest in playing with her. But recently, he started to say, come play with me, more.
Verbal skills have definitely been, they filter out of his mouth better. Mm-hmm. He doesn't stagger as much when it comes to putting together basic sentences, as in like answering questions and understanding the questions, and whatever we're asking him or we're prompting him about, he'll be more aware of what we're talking about.
Mm-hmm. But everybody noticed. It was the beginning. I thought it was just me, but the therapist, and then everybody started telling us. It was like, okay, it's something's working. Something's working really well.
Definitely, his grandmother, which is my mother, she has noticed a lot of changes in his behavior, maturity wise. There's been other people that have said basically the same thing.
And now she started eating vegetables, fruits and vegetables, without complaining. She's 10 years old, and then this is the first weeks that I really, tell her, just brush your teeth. Just brushing her teeth, it was like a nightmare. And but not anymore. Not anymore. She do it by herself. She dress herself. She comb her hair. So like a typical 10-year-old girl.
For example, like when we went to Disneyland, she's never been on a roller coaster before. Let's go on this roller coaster. She was like, "Oh no, not me. I'll sit out with you." When she realized, that I wanted to go on the roller coaster, and so she was like, "Okay, I'll try it," because she didn't want me to sit out. Not only did she try it, but she enjoyed it so much she wanted to get back on, and so she was aware of that I wanted to go on, which is very new, and she went out of her way to accommodate me, and she enjoyed the ride.
We did a lot of therapy, all kinds of therapy.
Okay.
Speech, occupational, yeah, any therapy. I should say this one that really gave me that clue that, oh, my child is making progress.
So we really recommend this treatment. But especially because it's, like I told you, it's nothing invasive, it's nothing painful. You don't have to force the kids to do anything they didn't want to do. But the thing is, the treatment, it really, they do something in our kids, That's the cool part.
I would recommend Microcurrent. It's different from other therapies. It's not taking any medication. It's not putting your kid through hours and hours of one room and one person. Just having fun, just drawing. She was in her iPad, just little, cables on her head. Around, she actually liked that. She was picking her colors. I have to say, since she's always had the same kind of therapy and it hasn't worked and it hasn't improved as much as Microcurrent, I think it's a good chance. A good risk to take.
Yeah, I would recommend that. Just because I feel the theory behind the technology really convinced me that this is something good for our kids.
I would, yes. Like I said, his cognitive skills have gotten better. His verbal skills have definitely increased. And his awareness of what's happening, situational awareness has gotten a lot better.
Uh-huh.